Hey, how you doing? Dr. Rick Mabanta. So I had an interesting encounter with a patient the other day I thought I'd share with you because it brought up some pretty interesting insights into how people think about chiropractic. The patient has been under care for about 2 months. She's having fantastic results, very happy with the care, very enthusiastic, so she's been sharing it with a lot of other people, inviting people to come and experience chiropractic. So she went to one of her friends and mentioned she knew the guy was having problems with his neck, having a lot of pain and symptoms, as well as other health conditions. And when she mentioned, you should see this chiropractor that I found. He's really good. He's helping me a lot. And the guy said, "Oh wow, no, I can't go. I have disc herniations." And she was like, "Oh, okay, maybe that's something the chiropractor can't help." She didn't really know. She's kind of new to chiropractic. So when I heard that, to me, it was such a surprise because chiropractic is excellent for disc herniations, for any abnormal condition of the spine and vertebral column, any dysfunction. Now, of course, dealing with those type of conditions, you have to utilize the proper protocol, the proper types of treatment. But to me, when she said that to me, it's like saying, no, I can't bring my car to the mechanic. I'm having problems with it and it needs a tune-up. Or, no, I can't have that carpenter come to my house. I'm having too many structural problems in my house. So the exact thing that you need to fix and correct the problem is something that they're avoiding because they don't understand how chiropractic applies to that specific type of condition. Now, with disc herniations in particular, I've had a lot of experience with it. I've helped a lot of people with it, and I have personal experience with it. I've had disc herniations myself. I've had motorcycle accidents, car accidents, which resulted in disc herniations. Positive MRIs, so we know the disc herniations there, exhibiting symptoms, have had chiropractic care and resolved it, utilized chiropractic care myself. And I've helped many other patients with chiropractic care and disc herniations. So if you understand what a disc herniation is, if you think of a disc like a jelly donut, and if you put more pressure on the jelly donut than on one side than the other, that jelly is going to squish out to the side. And that's kind of what happens with the disc. In the disc, there's a gelatinous material in the center called the nucleus pulposa. And when it has uneven pressure, the jelly or that gelatinous material can squish and compress out towards one side. It usually pushes out towards the back and will start to tear or rip the outer fibers of the disc, similar to the jelly donut where the outer crust might break open and allow that jelly to extrude out. Now, in 30 years of practice, I've probably seen only 3 disc herniations that required any surgery. Very extreme conditions. So there are times when surgery is necessary. Sometimes there's times when other procedures are necessary, like epidural injections and or physical therapy. But chiropractic in conjunction, and certainly as a primary approach to disc herniations, is very safe and effective in most cases. Oftentimes, chiropractic care exclusively can resolve the issue. The way that it does that is by restoring the pressure, having even distribution of force on the disc by restoring the relationship and mobility of the disc gently, gradually over time, to allow that gelatinous material to retract back to the center of the disc and allow those outer fibers to heal over. Those outer annular fibers, or like the crust in the jelly donut, can actually heal over. So when that is accomplished and done, it takes a period of time. The disc condition can be resolved. You can function normally. And I got to say, for me, with disc herniations in my past, I can function at a very high level. I can practice high-intensity workouts like kung fu practice and or yoga and pretty much anything I want. I don't have any symptoms and or impairment at all. And that's often the case with most of the patients that I see. So I just wanted to share that in case anybody is suffering from disc herniation or you're suffering from disc herniation yourself. The most and gentlest approach and most non-invasive approach is chiropractic first, and then move up the ladder to more invasive procedures if you're not getting the result there. So, a little insight to discs and herniations and chiropractic care. Thanks for listening. Talk to you later.